We've had a number of companies approach us about high-cost claims. Generally, a high-cost claim is someone who has spent $75,000 to $100,000 cumulatively over the past 12 months. If you look at the majority of them, they're basically around chronic conditions. Diabetes is a chronic condition, but we know that if diabetes is well controlled, we can prevent or long delay the consequences, the long-term consequences of diabetes, like renal failure, amputations, etc. Again, as an example, a number of those high-cost claims are people who have had poorly controlled diabetes, have other underlying chronic conditions in addition, and have not been managed well up until this point in time when they've now developed pretty much irreversible conditions. So we worked with employers to create preventive programs and management programs to try to prevent these high-cost claims by better managing these chronic conditions. We worked with a company who had a very young, primarily female workforce, and they had a very, very high number of babies born and ending up in the neonatal intensive care unit. When we looked at that, sort of why is this happening, we discovered that this company had a very, very poor to almost non-existent prenatal program for their pregnant women. So we worked with the employer and created a very robust prenatal education program and monitoring program to make sure that these women ended up with appropriate prenatal care that can prevent some of the issues with a newborn having to end up in the NICU. This particular company with the high NICU claims, we cut those in half within 2 years through this prenatal education program. And again, it was not viewed by the employees as intrusive, but they viewed it actually as a very positive benefit that the company was providing.